Well, today on the show, we're at the hospital, in Singing River Health System Hospital in Pascagoula, talking to Dr. Jeff Noblin, who is the orthopedic surgeon with Bienville. How are you, sir?
Doing well. How are you today?
I'm doing very well. You know, we've been coming to the hospital here for a few years now, and every time we come here, there's something new, something more advanced in technology when it comes to surgery. And we're talking today about the Stryker Mako system that y'all are using for orthopedic surgery. If you would tell us, give us a little background about that, because it has really advanced in the last few years.
It has. I think, first of all, I think we're all pretty fortunate. We live in a society and a community to where the hospitals will step out and get some of the cutting edge equipment that we need. The Mako system is it's a fantastic system. It's been around for 8 to 10 years, and we've been using it down here at another local hospital over at Merritt that we began years ago. But Singing River recently purchased one, and the Mako system is started out as more of a partial knee replacement, and now they've had a lot of more modalities that they can now branch into a total knee replacement. There's spine surgeries being done robotically with Makos, and then there's also total shoulder replacements that in the future, I think all those things will become more and more refined.
And it makes it a lot easier for you as a surgeon to do some of the different surgeries, you know, whether it's on the shoulder, arms, back, knee, whatever.
Well, it just makes everything more precise. In the past, we've gone by feel in terms of balancing different joints, and it's a really different concept when you can actually see the joint live on a computer, and you can adjust the joint where you want it to be to better fit that patient.
Well, explain how it works. The system works once you determine someone needs some surgery.
Well, obviously at the beginning, I think you have to be a perfect candidate for this, which right. I think the 100% when you're dealing with a partial knee replacement, if you're a really good candidate for it, you're going to do really well. And that's the whole, the beginning of the issue. So from a candidate standpoint, we divide the knee up into 3 different parts, and if one part is really arthritic and bad, then this type of replacement will really help. Once we get them started for the surgery and get them back here, the robotic system really helps things and makes things a little bit easier. The robot per se is this large machine here, and it doesn't do all the work. We still have to do most of the figuring of the cuts, but the robot, what it really does is it's almost like a navigation on a road that you won't run off the road. It keeps you between the lines. It doesn't let you color outside the lines or cut, and it keeps all the soft tissue more preserved, which I think is probably one of the biggest advantages. And the biggest issue is you kind of get to see real time here of the femur and the tibia of the knee. You can adjust the components exactly where you want them. You can balance the knee, which in my opinion is probably one of the most important things for a good, successful long-term outcome. But you adjust the components here on the computer until you really like the alignment, you like the range of motion, and you can basically real time bend the knee back and forth and see the tracking of the entire knee. Once you realize exactly what you have and you like it, then you basically lock that into the robot, bring that arm in, and then that's when you start the cuts on the knee replacement.
So you're no longer, as you mentioned, your hands are no longer in there actually yourself. It's the robot's arms or other.
Well, we guide the robot after we've done the calculations here, and you know, in the past there's certain, orthopedics is all about angles, and so you always want to try to achieve certain angles that you're wanting on a total knee replacement. In the past, we've had no real numbers to obtain those angles. And here, you can get these perfect angles that you want with a knee before you lock everything in to put the knee replacement in. And then once that's done, you cut those particular pieces of bone out, put the implant in, and you generally kind of reproduce exactly what you were wanting.
You hear of so many athletes nowadays that are having to have knee surgery or whatever after an injury. The robotic systems, is this what's helping them heal and recover faster than used to?
The robotics mainly is just going to be more of a joint arthroplasty business, so that's going to be a little bit of the older crew. Most of this stuff with the young, unfortunately the athletes that are playing that are in pro ball now are going to require some form of arthroplasty, either a total joint or a partial knee replacement when they get older. But this is mainly for a population that...
I was going to ask you, who are the good candidates for
this? I think age-wise, this in my practice, this gives me a good intermediate procedure to perform for somebody that's sometimes just fairly young, that's not a good candidate for a knee replacement yet. Somebody that's less than 50 years old, you have to be concerned about putting knee replacements in. And so it gives you an intermediate step, does not burn any bridges. You can still have a knee replacement down the future, which is the good thing about it.
Well, hopefully I won't be needing it anytime soon, but I'm glad I fall in that age range because I'm above the 50 area. So once somebody comes in, I guess they have to go to their general practitioner, find out if they've got a problem or whatever, and they get referred to you and you do the diagnosis, you go over exactly, okay, this is what we're going to do to you. What is the recovery after they do the surgery?
I think that's one of the advantages of this too, because you don't have to remove any ligaments. You don't have to affect the soft tissue. So the recovery, in my opinion, and I've been doing these for probably 8 to 10 years, and the people are very happy afterwards. They get to recover pretty quickly. They're putting weight on it immediately afterwards and progressing that, and generally are off any kind of crutches or any kind of walking device after about 2 weeks.
So, and I know Signal River Health System has a great program for getting a recovery that they have over off of I-10. I remember doing a segment over there one time.
Right.
For doing rehab. That's the word I was looking for. I couldn't think of it. The rehab program that the Signal River Health System has is phenomenal. But how long does the average surgery take for something like this?
About an hour. The whole setup is, and the completion of the surgery is about a 2-hour procedure, but the actual hands-on procedure-wise is about an hour.
And they're usually up and out of the hospital within a day or so?
Probably the last 4 days, they've all been out. 4 years that we've been doing them is about they're all outpatient surgeries. So they will.
Really?
So the one we just completed here today will go home about 2 o'clock this afternoon.
And see, I would think it's something this big that they would actually have to stay in the hospital for a couple of days.
Well, I think another thing that helps them is that we've come a long way with different blocks from the anesthesiologists and so forth to make people more comfortable. But you don't affect the soft tissue as much with this Mako system, and I think that really makes people more comfortable and allows them to get out of here a little bit quicker.
Well, I look forward to seeing what new technology comes up in the next in 2019, because I know that at the rate things are going, y'all going to be able to sit at your desk and get on the computer and just sit there and punch in some buttons. Thank you so much.
You're welcome, Jeff.
Appreciate that.
You're very welcome.
If you'd like some more information, of course, about that, or find out if you're a candidate, maybe you're having some issues, see if you need some hip replacement, knee replacement, or whatever, you're going to be in great hands with folks like Dr. Noblin here, with the Bienville, and the great folks at Signal River Health System. So check with your doctor. Of course, you have to go through all the proper channels there to find out exactly. And of course, you can go on their website and find out what other services, because there's so many wonderful services that are provided by Signal River Health System here on the Mississippi Gulf Coast. So if you're in need of some help, give them a call and get your physician too.